Hello, welcome. Good morning, good afternoon, depending on where you are in Austria or in the US. Thank you for joining our webinar on telehealth in the US. So yes, the program for today is that I will just say some brief words myself. Then I will introduce you to our speakers. We'll have two great speakers and a short Q&A session in the end. You will be able to ask questions in the Q&A box and in the chat function. So my name is Valentina Marino Milan. I'm here the sector manager for health tech and innovation at the Austrian Trade Commission in New York. I'm also responsible for our collaboration with the MIT in Boston. I myself am a medical doctor's background and have a public health background as well. I slipped into the innovation and tech scene through my research and now ended up at the Austrian Trade Commission here in New York. Maybe to start off, just some brief words about telehealth and why telehealth is getting more and more popular and important, with whole countries requesting their people to stay at home and maintain social distancing for the past 1.5 years. As we all know, telehealth is becoming an increasingly attractive solution for people who have to stay at home, but at the same time have to see a doctor. The WHO as well as the CDC both recommend using telehealth to reduce the risk for spreading the virus. And also people who have COVID can be monitored through telehealth without being in contact. A study from the American Association of Retired People also showed that COVID is getting more and more popular. More people are aware of the term telehealth. And besides the fact that it limits physical contacts, telehealth is also the healthcare access solution for people wherever they are in the world. And they are able to see doctors, specialists, wherever they are located as well. And further, virtual visits cut down on time of travel, time off from work, the need for child care, for example, as well. And yeah, this research from the American Association of Retired People showed that 85% of people would use telehealth to renew prescriptions, 79% would use it to get help for providing care for a loved one, and 76 showed that they would even discuss new medical issues, and 74% showed that they would see a doctor virtually for a routine visit as well. So yeah, this shows the potential of telehealth and the various applications, which these are just some of them. And yeah, just briefly, what can we do here at the AC in New York to help companies who are interested in the US market and in telehealth, maybe expanding what they're doing to telehealth. And I'm trying again to go to the next slide. Yes. So yes, on the one hand, we are making contacts with people you need to have contact with when you want to enter the US market, ranging from lawyers to tax advisors, but also like contacts in the field. We have the EO initiative, the Internationalisierungsoffensive, where you can apply to for subsidy if you're like for the first time exiting the Austrian market into the international market. And we are planning events. So our first in-person event again will be in December, from December 1st to 3rd. And there will also be a focus on medtech companies. If you want more information, later we'll show you our contact information. And yeah, more specific to digital health, we're planning a landing zone next year and also an in-person event. And again, if you want more information, just contact me. But yeah, without any further ado, I want to present our amazing speakers today. First, Lukas Sepa, who will just briefly turn on his camera to say hello. He's the co-founder and head of growth of a Vienna-based digital health company and startup called XUND. And yeah, Lukas will tell you more about his success story in our Q&A, but I just can say that his company is flying high in the Austrian startup scene at the moment. And yeah, I will ask Lukas questions about XUND and their first steps in the US market.
Yeah, hi, and good evening from Vienna. Looking forward to the next hour.
Amazing, thank you. Yeah, our first speaker will be Dr. Friedrich Böttner, who is an orthopedic surgeon at the #1 orthopedic hospital in the US, the Hospital for Special Surgery. He will talk about the telehealth application he uses in his hospital. This is especially interesting as in the field of orthopedics, one might think that the personal contact to people is especially important. So I'm very curious about the applications, and he will also talk a little bit about reimbursement of telehealth applications and legal aspects. But of course, he's a doctor. He is from the user perspective. So yes, thank you very much for joining, and I give you the floor.
Thank you, Valentina. I want to give a short overview. So as Valentina already said, I'm an orthopedic surgeon in New York, and I focus on total knee and total hip replacement just as a kind of background. And I want to give you a short overview of what we're doing with telemedicine in the US. Just to give you an idea where we're coming from, in 2019, before the COVID pandemic, we would do 2 telehealth visits. So it was really not like significantly less than 1% of our cases were done telehealth. In 2020, that moved up to 9.3%. There was actually a time point when 45% of our encounters were in some point telehealth related in the second quarter of 2020, giving you an idea of what an enormous growth telemedicine has had in the US. It has kind of tailored back a little bit. We're now at, I think, 7 to 8%. We now at 7 to 8% on our appointments. So it is a little bit less than it was in the second quarter, but in general, that's where we are right now. So that has had an impact on research. So we're working very hard on trying to understand the impact that telehealth has on patients. And so if you look in PubMed, which is a big database for medical publications, so publications on telemedicine have really skyrocketed in 2020. So when we talk about telemedicine, what does that include for me in my practice? It's like telehealth visits, where I have a virtual encounter with somebody that's not in my office through some kind of video sharing platform. The second is virtual checkups, where my office contacts people remotely on their cell phone or something like that to check on how they're doing. And it also involves non-face-to-face patient portals, where a patient can send me a message to my portal. I check on it whenever I have time, and I respond back to them. So almost like an email within the electronic medical record, or EMR as we call it here. These encounters can be synchronous, like the telehealth visit usually is real time. I'm talking to the patient at the same time, or they are synchronous. That means somebody might get information while I'm not even online, and both of those we apply right now. So this can result in pretty high patient satisfaction. Like one big concern was in the beginning, like if we see a patient online, is that patient going to be as satisfied as when we see them in person? And the data seem to be suggesting that for the initial visit, it's a little bit tricky. The patient doesn't know me yet. Just to connect online is tricky. But once you have a follow-up visit, actually that satisfaction rate goes high, and very satisfied 80% of the people. That suggests that once the initial contact is made to a patient, you can actually achieve the same satisfaction online as you can in a real visit. And when you look at this paper here, it suggests that actually patients really like their telehealth visit. That would save them time. They would prefer telehealth visits over in-person appointments. And that's something that we see, especially for people that don't have easy access. So it's improved access. What does that mean? Now, it allows patients in rural areas that don't have good doctors or don't have easy access to doctors to actually consult with specialists in more specialized centers that might be further away. It can even be in big cities like Vienna or New York. I don't know how the traffic situation is with you, but for us in New York, we have in part disastrous traffic issues. And so it might take somebody an hour and a half to drive into the city to see me in the city. So besides the value of offsite locations, telehealth really cuts down on travel time and can be a huge advantage. It can also provide patients, it gives them more flexibility. You don't always have to be where you want to do the appointment, you don't have to plan as much time. You could almost do it while you're at work and just like, take half an hour to do your medical appointment. And then I think that's something that is a huge benefit for the patient. So greater flexibility. And it also does provide postoperative instruction without calling the office. Now, to give you an idea what we're doing, like I use videos to inform my patients. So they kind of get a video before they have their medical clearance, or a video before they come to the surgery, the morning of the surgery, to explain to them what to expect. I also use an app to kind of talk them through certain issues that they might have after surgery. So like, kind of even things like, how do you, what kind of exercises do I want you to do? And I use the app to explain that to them. I also use the app to, to ask the patient to give me information about the range of motion and things like that. So there is a variety of things I'm doing. I'm providing self-care tips. I manage their pain remotely. I monitor the progress of the range of motion and the activity level without me actually contacting the patient. And for me, it's easy because I see multiple patients on one screen, and I can easily identify patients that are trouble. And with the self-care tips, the software itself often recognizes when a patient is not making the progress that I want them to do. And there is data now that suggests that I can, measure range of motion quite well with the app. And when you look at responses I get from my patients, they say, like, I realized the doctor was actually monitoring my progress. So, kind of because my office will call them if something is not right, or it made me accountable about doing the exercises and taking the medication, because a patient now knows I'm getting monitored, so they work harder. It kept them on track, or they felt like they were checked on, and it gave them, more safety about moving on with the surgery. So all that is really a huge benefit for patients. There are things we can't do online, things that are crucial in our interaction with the patient, like palpation, touching something, feeling something, testing the strengths, or doing certain functional assessments, like testing whether an ACL is working or something like that, or maybe for a cardiologist to do an auscultation. These things are not possible online, and we have to find a creative approach of how we do that. Now, you could apply a goniometer to your video screen to get a sense of how much rotation, extension, range of motion that patient has. You might create certain routines of measuring certain things that you actually want the patient to do. But that highlights the importance. You need to have a standardized examination, and you need to communicate that to the patient in order for the appointment to be valuable. I tell you, the first time I had a telemedicine appointment, I spent all this time telling the patient what I want them to do. So you have to actually prepare that, and the patient, maybe either through a document that you sent them in advance so that they know what I actually want them to do if I ask them to flex the knee. So that has to be standardized. There are some limitations. I find that new patients, it's difficult because it's really tough to establish a doctor-patient relationship if they don't see you face to face. It's tough to trust somebody that you just see on a monitor. There are the things that I said before, like palpation, auscultation, that I cannot do on a telehealth visit. And there are practical things, like I might want to inject a joint, or I might want to put on a cast or a brace. I mean, these things I can't do. And 28% of the patients do think that the lack of physical contact can be a problem in telehealth over a longer run. So you at some point might have to see the patient. Okay, technological difficulties. We quite honestly in the US are probably blessed. Why? Because we have great internet in the entire country. Our older folks are quite tech savvy. They research us online. They are used to send emails to their grandchildren. If I compare that to my parents, I don't think they are tech savvy at the level that most of my patients in New York are when they're in their 70s and 80s. I think we need to consider that some of our older population is vision or hearing impaired, and for them, telehealth might not be the best option. And there need to be an alternative plan for technological issues. What are regulatory issues in the US? Now, one of the biggest issues in the US is that except for the exemption granted during COVID, I am, as a New York licensed physician, cannot provide to a patient, provide care to a patient that is localized in California. So what that means is if I want to take care of a patient in California, I have to get a license in California. And that might sound a little awkward, but that are just regulatory limitations we have in the US. there is a little bit an effort in the US to get an interstate medical license, and all the dark blue states actually follow that. So if I'm licensed in one of those dark blue states, I can get a license for all the other states. And I think that's a first step to grant licensing throughout all states in the US. I don't think Austria has that problem. But if you imagine you would run a telehealth application for entire Europe, you might not be able to provide care to somebody in Spain, for instance, that's in their vacation home there. So but that's in the US, that's a real issue and limitation. Cost effectiveness. So yes, there are real benefits for the healthcare system, you know, and for the patient themselves, because there are certain costs that just don't exist if you do it online. You don't have to travel, you don't have to park your car. Like even parking 2 hours in New York can easily be $40. So, you know, like, so there is a considerable health saving. Quality savings, if I follow my patients more regularly through remote monitoring, I might identify complications early before they become a surgical issue, which can save cost. And then we also need to understand, you know, in the future a little bit better what cost savings are. Reimbursement. Now, in the US, we have all kinds of providers. There are physicians like myself that provide care, but then we have NP, nursing practitioners, which are like a little higher level nurse, if you will, that can provide certain levels of care on their own, and physician assistant PAs that you see here on the right side. And they can provide certain things during the healthcare. Then there are three things that Medicare, which is Medicare is the insurance for the older people, everybody over 65, if they have worked at least 7 years in their life, they qualify for Medicare coverage. And that is something very important, because that, you know, allows them to do telehealth visits, virtual checkups, and e-visits all online, and Medicare recognizes that in their insurance policy and will pay you for that. Now, one of the issues is in the past, encounters in the US have really worked, you know, kind of, let me just like kind of move on, have really worked through, you know, what I'm actually doing during the encounter allows me to charge a certain fee. So a new patient can be a level 1, level 2, level 3, or level 4. And what level I can bill, like the level 4 is the highest reimbursement, level 1 is the lowest reimbursement. And what I can bill in the past depended on, you know, how many things I actually asked the patient, whether I got a complete review of systems, how complex was my examination, did I examine their shoulder, or did I also examine their elbow and their hand? And then how complex was that patient? Was that a straightforward decision making, or was that a very complex decision making? And based on that, I could set a level. Now, in a telehealth visit, that's quite complicated, because we might not be able to do all aspects of that. And for that reason, we now have the ability to bill based on time. So if I spend 25 minutes, then that is a level 4 visit. And I think that has really helped. Or if I spend 45 minutes with a new patient, then that's a level 4 visit. And something we have all encountered with telehealth is that it's much more difficult to go through your day and be as efficient. Like I can see 6 patients in an hour if I'm in the office, but I might only be able to see 3 patients in an hour when I'm on telehealth, just because people talk more, they think like you're just there for them. They don't see the full waiting area. They have no connection to how your life works and what the back-end schedule is. And therefore they seem to spend much more time with you. And you're also not as efficient, since you cannot examine them yourself. You might have to ask them to do certain parts of the examination themselves, and that takes time. And so having a time-based reimbursement system is actually beneficial and has helped us quite a bit. Yeah, privacy concerns. Now, when you do these things, you have to be HIPAA compliant. So HIPAA is the Health Insurance Portability and Accountability Act. What that means is I cannot use a means of communication with my patient that would release their personal health information. Like if I use an insecure video sharing platform that somebody else might be able to dial into and listen into a private patient encounter, that's not okay. I need to have a video platform that follows HIPAA guidance. If I want to exchange text messages or messages with a patient, this has to have a certain level of encryption, and it has to have certain levels of security set in place in order to be HIPAA compliant. So when we now do a health appointment, what does that include for us at HSS? So when my office schedules an appointment, they have to make sure that this patient has access to My HSS, which is pretty much our online platform. My HSS allows them to see when is their next appointment. It allows the patient to see what the results of their tests are, but it also allows them to connect into a telehealth appointment. Then 24 hours before the appointment, the patient needs to complete their insurance information. They have to pay their self-care price if they have to pay for something. They need to sign a consent form that they are actually going to participate in telehealth and what the limitations of that are. And then they need to ultimately be set up to join a Zoom conference call. Yeah, and once the patient is in it, on my day of appointment, I actually see it on my screen as a green camera that I know this patient is there to talk to me in my electronic medical record system. So that's all run through the same system where I usually store patient reports or where I document my encounters. Like on my calendar sheet for this day, I will see this is an online patient, and when their camera is green, I know this guy is actually available to talk to me. And here's, unfortunately, we're using a PDF, so this was an animation. It kind of goes through the steps that the patient has to do. They have to sign the consent sheet, then they have to click on the camera to go online. And then the same applies to me. Like I will see a little green camera, I click on this, I then start the encounter. I have a start the encounter button that I click on. So that now starts recording time that I spend with the patient. And when I'm done with my encounter, I click on end encounter. So the software will automatically store the amount of time I spend with the patient. And then I just click on the button to connect either to my Zoom connection. And that will actually be, you know, kind of a standard Zoom window. So like when you go on Zoom, the same kind of system we use to talk to the patient. So I can see them if they have a camera, they can see me if they don't have a camera. And what are requirements for a telehealth platform? It has to be easy accessible. Like with Zoom, it's something, you know, every patient has on their phone, so it's easy for us to use to connect with a video platform. I have to be able to do multitasking because I need to run my video platform, I need to have my X-ray up here, I need to document the encounter. So that's something that you have to get used to, because in the past I would do it, just talk to the patient and then I will look at the X-ray, and then, so like some of it I can still do, but there's a little bit more multitasking involved if I do telehealth. Documentation, I need to interface that into the electronic medical record so that my electronic medical record knows how much time I spent with the patient and whether the encounter actually happened. This all has to be HIPAA compliant, and I need to code it appropriately for reimbursement, and I need to document that the patient is in a state that I actually have a license at. Okay, so I think patients will drive telemedicine demand because of availability and convenience, but I think ultimately this will be contingent on physician acceptance and healthcare system partnerships. And I think in the US, we have made major steps forward. Right now, I think our biggest issue is that we're not licensed in all states and therefore cannot always provide care to patients through telehealth visits. But that's going to be a thing in the future that's going to be sorted out. And here are a couple of links that can be used to kind of get information about telemedicine in the US. Thank you very much.
Thank you so much, Dr. Böttner, for this very rich presentation and a lot of information, which is hopefully useful to our listeners. We will do the Q&A in the end. So if it's fine for you to stay on, I already saw some questions popping in. So see you later. Thank you very much. Okay, then we go on to Lucas Sepa. As mentioned, co-founder and head of growth of XUND, and we'll do a Q&A session for the next about 20 minutes. And I will just start with my first question. What is XUND?
Yeah, hi again. First of all, thanks for the invitation and for giving us the stage. So again, my name is Lukas. I'm one of 3 founders of XUND, which is a medtech startup based in Vienna. For all the non-native speakers, XUND is the short form for gesund, which means healthy. So you see, we are, back then pretty funny guys. And when we started the company, I mean, again, maybe one step back. So what we have done over the last 2 years is what we call develop an AI-powered health assistant that helps patients to make better decisions. And when we started the company, we wanted to be the go-to platform, being the first digital point of contact. But we soon realized that we can add more value when we move to the back end, being a back-end application. So as of today, our technology is certified as a medical device in Europe and enables providers to digitize their operations and provide their patients customized and end-to-end solution focused on the respective patient's needs. As you've probably know, that we are not the only ones out there, and definitely not the first. But being second mover brings certain advantages, especially speed. And we could learn from the mistakes of others, and actually also thanks to COVID, honestly, capture a market they basically opened up for us. And that's also why we are invited today, because we are now looking also across over the Atlantic and planning to enter the US market by next year.
Thank you. So how does XUND make a difference? What is the application of XUND exactly?
Yeah, so basically, again, back then, and the situation is not different today, more than 50% of people don't understand basic health information. And what they usually do is they go online and ask Dr. Google for help. And we have all done it before, and in most cases, it's not the best given advice. And the simple reason is that Google was never intended to be a medical device. So in a nutshell, we are putting symptoms into the right context. So with our digital health assistant, we help patients to better understand their symptoms, get evidence-based feedback on what could be causing them. And then, and probably that's the biggest pain we try to solve, is then connecting patients to the relevant point of treatment.
And how should this help the healthcare system?
Yeah, I mean, the speaker before already listed some of the main advantages. So we are now focused mainly on private health insurances, and they are driven by costs. So I would say that's probably one of the best arguments for telehealth or digital health in general.
Yeah, and I also think, as I understood, that people not just go to the hospital, just go to see a doctor, but first also can check themselves if this is needed, right?
Yeah, absolutely. I mean, there's a lot of fantasy going on with what could be the world 5 years from now. So let's see what happens. I think when we started, we had a lot of projections about the future. Usually, progress is unfortunately slower than everybody anticipates. But COVID helped a lot to move certain stakeholders accelerate certain progresses within stakeholders and within this ecosystem. So we see, even in Austria, a lot of joint efforts to change the system, to rebalance the relationship between the patient and the doctor.
Yes. And you already touched on it. How is XUND different from other digital health startups and companies?
Yeah, I think the main difference is that we really soon realized that being the go-to platform is really difficult. I mean, there are companies out there with a lot of funding. When we started, there are already companies out there like Babylon, which some of you may know because they're active now in the US. They have raised more than $1 billion already. So in Europe, we're much more conservative in terms of funding. So we still believe that to make an impact, it's better to work together with stakeholders. And that's why we are focusing on the technology and providing that to healthcare providers. And we do this via medical API. So basically it's a B2B2C business where healthcare providers can use our certified medical technology, build on our technology their front end, and provide their made-to-measure interface and user experience to their patients. And this actually opens up completely new use cases across the healthcare industry, such as not only insurances, but also hospitals and pharma. Just today, before the webinar, we hosted one of the biggest pharma companies globally. So there is
amazing.
A lot of exciting things happening.
Yeah, amazing. For example, how could this look like on an insurance company's website, your application?
Yeah, so just 3 weeks ago, we announced and launched our first official cooperation with an insurance company, namely the Austrian-based Vienna Insurance Group, and they wanted to provide our technology not only to insurance holders but to everyone. And what we have done together with the Wiener Städtische Versicherung is integrating our technology, our medical device, into their web-based chatbot. So now, if you're based, you can be based anywhere. So if you enter the Wiener Städtische, if you look the Wiener Städtische website up, then you can, and if you speak German right now, then you can get a first, what we call preliminary assessment. So it helps you to identify the most probable causes, and then you can download a report, and that helps you to find the shortest way to the next point of treatment. That's only the beginning. What's the next step? And we are experimenting new ways of engaging the user, and what's coming next is integrating that into insurance apps. So and building an ecosystem around our solution. But I mean, there we are talking about years probably.
Yes. But now you have the first steps in the US as well. So why and how do you want to enter the US market with XUND? What is different to the Austrian market? A lot of things happening.
Yeah, I mean, the first major milestone was definitely receiving the medical device the certification as a medical device in Europe. There were major changes in the regulation this year with the medical device regulation. So solutions like ours had to change their system. So basically, before May this year, things were like the Wild West. Manufacturers like us could say, well, we are a medical device, but nobody took a look at it. So this changed by May. Now, solutions like XUND, in our opinion, needs to be class 2 medical device, which means that somebody, some institution like the TÜV Süd has to audit the company and the product. So that was the major milestone this year, and that helped us to gain some traction over the last couple of months. So we not only closed the Vienna Insurance Group, but also the Generali, which is active in the US. And you know, one account helps to get the next account, and we also closed S&P 500 company whose most important market is the US by far. We are not able to disclose it yet, but that will help us with this partner to enter the US market. And it's one of the main goals to be there by at latest second half of next year.
Very interesting. And what are the first steps and your first experiences with getting acquainted with the US market?
Yeah, probably still too soon to share some deep insights. We were invited by the US Embassy in Austria to the USA Tech Summit in June. And since that, we are in constant exchange with the embassy, with the institutions on the East Coast. That's probably the area where we want to move. I think since 2 weeks, it's clear that we are able to apply for a visa again. So that will help us to probably visit the US already this year. And what's the main showstopper still is the communication and the process with the FDA. So as of today, we believe that a solution like XUND can be excluded from being registered as a medical device. So it's called enforcement discretion. We're still in talks with the FDA. It probably takes some couple of weeks, but if that is solved, then nothing holds us from not going to the US.
Sounds good. So yeah, do you have any tips for people who are interested? Something you want to share? You want to wrap up with?
Well, it's always difficult to give some tips. I would try differently. So we are, from the very beginning, it was important for us as a young health tech company, med tech company, however you want to name it, that we take a partnership approach. So the healthcare system is very fragmented, and it's all about cooperation, in our opinion. And even when we only had mock-ups, so no app at all, no technology at all, we started to talk with the experts and the healthcare stakeholders in Austria. And even if you can't show anything, it's important to get some feedback and to be in some sort of exchange with the others. And that's, I mean, there are some participants today. We are always eager to look for new partnerships apart from the ones we already have, and we're always looking forward to that.
So it's a team effort, and I also recently had a call with a company who is already big in the US, and they told me one of the most important take-home messages is find a good partner, also in the US, who has credibility and size and reach and knows the field. So I think partner is an important point, and partners and collaborations. And thank you very much for this. I see a lot of questions in the chat. I just want to give you the possibility to say something if you want to say something more. And if you're ready, we can move to the Q&A session. Then Dr. Böttner, I would invite you to turn on the camera again if you want to, and join our Q&A. Thank you. So I will start with the first question, and it's for you, Dr. Böttner. The question is, do you record the teleconsultations for documentation? How do you run the medical documentation?
We don't record encounters, so it's not that we do a screen recording of the encounter, and I think that would probably face a completely different level of security, what to do with the videos, how to store them, all that. So we don't do that. I document an encounter the way I usually do. Like, I make a general note. I say, like, the patient has had these complaints. If I did a part of a physical examination as part of the encounter, I will document that accordingly. And then I will write my discussion, what I'm thinking, what I'm recommending. And then I might order medications online. We have an online, in the US, I can order medications remotely. So through my electronic medical record system, I can order a medication that then goes automatically to the pharmacy, and the pharmacy will dispense it to the patient. So that are the steps. The encounter itself documentation doesn't really change. The only thing that the system does differently, it stores the sign to consent form, and it stores the time that I spend with the patient during the encounter.
All right, thank you very much. Then I will just go back and forth between you, Dr. Böttner, and Lukas Seeper, so we have everybody has the floor. The next one is for you, Lukas. How long did it take to set up the cooperation with the Wiener Städtische?
Yeah, longer than usually than originally anticipated, but they were also the first who trusted in us. So it took some time, to be honest. But back then, when we started the talks, we had no product. It wasn't ready. There was no medical device. And again, we are pretty happy that Wiener Städtische is the first company, and the partnership goes well. But I mean, in general, this development and the sales cycles of a medtech company are just very long. So we usually calculate with around 9 to 12 months from the initial contact to finalizing the contracts and starting the development and launching with a first version of the product.
I turned off the camera, sorry for that. Dr. Böttner, for you, would you consider using the smart glasses for the video conference, meaning you proceed with OPE and then your manipulation would be broadcasted for training reasons?
Yeah, I mean, that's, I think, smart glasses. I think we're now entering a little bit of different territory. So like considering me using my smart glasses while I'm doing an examination and then use that for training purposes for people, for instance, in Austria, to see what I'm doing. Yeah, that's a possibility. I don't think that we have used smart glasses that much for that right now. We have used them a little bit in the operating room just because they have a camera built in and they can see what we see. I think for a patient encounter, we have usually used an external camera that can show what I do and the patient at the same time, because my point of view might not always include the entire patient through a smart camera. But in surgery, it's sometimes quite helpful to have a camera right, between your eyes or just a little bit on top that kind of focuses in on what your field of view is.
Okay, there was a follow-up from the same person, or to help your colleague doctor if she cannot make decision, just look through their eyes and see what your colleague sees. But I think you answered that. So for you, Lucas, how long did it take you to fulfill all regulatory requirements in the US? I think you are in the process.
Yeah, absolutely. As I said before, it depends if we need an FDA approval. So as of today, and after their communication with the FDA and with the consultants we need, there is some exclusion to solutions like XUND. As in Europe, as the medical device regulation, the same goes with the FDA. Usually medical devices are classified after certain risk profiles, and Europe sees it differently. So we are class 2 medical device in Europe, and it seems that we are lower risk, seen as a lower risk in the US, which means shorter periods of approval.
Thank you. For you, Dr. Bettner, is the messaging software user-friendly? Do you use it?
Well, for the patient, I think it's user-friendly because they can kind of contact us on their own time. So they can kind of go on this My HSS app, and then they can kind of put their question in for me. For me, it's actually user-friendly too, because I can answer the question whenever I have time. It's not like an incoming telephone call. Like, it's very disruptive if you have incoming telephone calls, because what I've done right now, I need to drop immediately, get on the phone and talk to the patient. I actually like the patient sending me a question, and then let's say in 20 minutes, I have time to answer it. I go in and I answer the questions I want to answer. So yes, there's definitely a benefit for me as well. And it's user-friendly. In my generation, I don't know how an 80-year-old doctor or 70-year-old doctor looks at it, but for me, it's actually quite user-friendly. Now, there is one general issue with texting to answer complex issues, is that there is no way to read between the lines. Whatever the patient wrote is kind of what I see. And it sometimes takes multiple messages to get to the core of what the problem is. While when I'm on a telephone call, I can follow up questions and I can, solve things right away. So text messages are not always the best way to conquer problematic things, but they have benefits. Like, for instance, a patient can send me a picture of a wound. That makes it much easier for me to judge whether that's a serious situation or not, which in the past on the phone, I had no idea what was going on and really relied on the description of the situation more than anything. So pros and cons a little bit.
Yeah, thank you. That's very interesting, especially being disrupted during the day through phone calls. I think that's a huge part of everyday life as a doctor. So that could change a lot. Yeah. Dear Mr. Lucas Seeber, did you hear about our Austrian project regarding telemedicine? It is running now, very successful in Germany. The project is an innovation from 2014. I don't know which project you are talking about. I will just say maybe the name, but I don't know if I pronounce it right. It's a question from Humayun Sodafi. I don't know if it rings the bell, or maybe we need more information, please.
Yeah, nope. at the moment, I have no idea, but as I said before, my contact information is here, so looking forward to any exchange.
Sounds good. Then please get in touch. So to Dr. Bettner, is the HIPAA compliance system US only? If yes, do you know the analog in Europe, Austria? I mean, this is maybe a difficult question to ask.
Well, I mean, it's a US regulatory requirement. It does not apply to Europe. Europe has, and I'm not an expert, and I think Lucas might be better to answer that. Europe has a very complex data privacy law, and I think that in general will be applied to certain things that, you know, in the medical field as well. The US HIPAA system sets certain standards. It sets encryption standards. It sets standards to at what time point is something a protective health information. So, you know, if I drop an X-ray on the floor on Fifth Avenue that doesn't have a name on it and nothing else, I mean, it's not a protective health information. But if there's an identifier on it, a date of birth and a name, then it becomes a protected health information. So it sets standards on what is a protected health information. It sets standards on how these communications have to be protected. And it kind of sets a regulatory environment for that. So I don't know what the equivalent in Europe is. I just assume that there are pretty strict requirements in Europe too, just because in general the data privacy laws are stricter in Europe than they are in the US.
Thank you. Maybe Lucas, you can say something to it.
Yeah, I mean, there are some differences between HIPAA and GDPR. On top of that, what we're seeing now in Germany, every company which wants to be a manufacturer of a DiGA, digitale Gesundheitsanwendung, needs to be certified also after ISO 2727001, which is information security management system. So I mean, there's a lot of standards to comply with. I think the situation in Europe is probably better now than in the US. More focus on privacy and security by design. But in general, if you're out there in the domain, then usually you include both standards, so being HIPAA compliant and GDPR compliant.
Thank you for the teamwork. Then for you, Lucas, will you stay with the name XUND in the US, and what are your thoughts around this?
Yeah, just today, as I said before, we today hosted a global pharma company here, and they also asked us, because we're just preparing our Series A and want to cross the Atlantic. Honestly, yes. I mean, we are not the front door. So when we are behind our healthcare partners, XUND is mentioned, but it doesn't need to be, you know, the first thing you encounter. So yeah, we'll see. We don't have that much egos, so we are not, you know, sticking to the name, but we are encountering these questions since the very beginning. Yeah, good question, but the question we hear very often.
Thank you. So one last question, because we have to wrap up soon. Dr. Bettner, do you consider possible to make standard set sequence of movements for patients? Okay, sorry, I have to read this again because there are some typos in the question. Okay, do you consider it possible to make a standard set or a sequence of movements that a patient is informed on in advance and uses to demonstrate specific issues she has? And what do you think about possible ways to measure the level of pain more or less objectively?
So for the first question, yes, I think you have to do that. So every physician has to look at their specialty and come up with a standardized documentation of their examination, as far as they want, when during the encounter they want the patient to do certain steps, they have to document that in a way that the patient upfront knows what is expected of them. It's impossible to show them, oh, I want you to do this or that. I mean, they should have either a video preparation for that, or they should have like some kind of printout that they can look at and say, okay, the doctor wants me to show this, wants me to do that, and then so that will make it much easier. The second part of the question was, sorry, what was that about the about Valentina? What was the second part?
About the pain levels and how to measure them more or less objectively.
Yeah, you know, there are certain validated scores. Like in medicine, we usually use a visual analog scale between 0 and 10 to document pain, and that's something that's really documented. I don't think that at this time point we have any biosensors or something like that that would measure pain in a more, you know, objective way. We know that documenting pain on a scale 0 to 10 is very reliable for that particular patient. So if I want to look at if their pain goes down, if I compare that 0 to 10 scale over time, it's very reliable. It's not as reliable if I compare the pain that I have to what somebody else has. So like I might rate it as 10 because I'm just sensitive, and another guy might rate it at 3 and because he's just tougher with the pain. And so it's kind of tough to really have an objective measure of pain, but it does help us if we compare it to where was it before, where is it now, where is it, you know, in 2 weeks from now. That trend helps us, and that we do through a simple 10-point scale. 0 to 10, 0 no pain, 10 is the worst pain you can imagine.
Thank you very much. And yeah, thank you. Special thanks to you both for participating, for speaking here, for sharing your wisdom. And yeah, thank you for everybody participating. And I found it was a very, very interesting event. I hope you thought so too. And yeah, please contact us if you need something from us at the Austrian Trade Commission in New York. You find the email here with the name of our trade commissioner to the in New York. And yeah, thanks again, Dr. Böttner and Lucas Sepa.
Thanks.
I will try the video briefly. Yeah, bye.
Very good. Okay. Bye-bye.